Good afternoon, dear colleagues, everyone who is celebrating Happy Easter to you. So, although it is a day off, a holiday, someone have joined and would like to welcome you here on in our first section. So, we have very important topic. It will be multiple presentations, and you will be enabled to ask questions. It's our joint project with the Health Ministry of Ukraine and with the NHSU, and together with the counterparts that I will shortly introduce to you, and with the other early birds and the other partners that I'm happy to introduce. So, a catamnestic pediatric case management in the PMG program of medical guarantees, section 1, hopefully, so more sections shall follow, and we'll just find out which topic are missing out. So Daria Herasymchuk, who is a presidential advisor for children's rehabilitation and children's rights. So please go ahead. So you don't have to be afraid of your accomplishments because they are correct. This should be the motto of the parents. So to safeguard lives of their children, especially when we are talking about disabled people, about disabled children. So the children, so with the risk of any impairments that should emerge because those cases, time plays against children. So every day, every hour, every minute are detrimental to the children because these are very crucial for children's development. I'm very concerned to find out what would have happened to my own daughter when 16 years ago, of my desired girl, and as if I had a kick in the knee. So she had been diagnosed. So, but I put my hands to work right away. So to ensure her rehabilitation, that is why just myself as the presidential advisor for children's entitlements, rights, and children's rehabilitation, and also as the mother of a daughter with audio impairment who dances hip hop, and she speaks, and she is a ninth grade student at high school, and she will soon become a clothes designer student. And I will have to speak about catamnestic case management. I am deeply convinced it is one of those important decisions that is impactful on the lives of those families, just like mine, so who've been confronted with the challenge and catamnestic observation as a series of monitoring of child's development. So the ones who are affected by risk to be able to identify early deficiency and also prevention of possible disease, and also putting the child into access to specialized care, including early intervention. This is something that the Ukrainian children require. So this service, just like the community visit, catamnestic specialist, early intervention team, neonatal screening, this is the pathway to diminish the impact of the impairment of children's development on their life to bear. This is the equation for you to bring down the risk of disability emergence among children. So to prevent children getting into the institution, neonatal screening is a comprehensive scan and screen of the neonates to be able to find out hereditary disease or innate pathology among newborns. So 4 diseases, but from October 2022, so 21 orphan diseases. Thanks very much to special support of the Ukraine's President Zelensky. This opportunity has been given to all maternity hospitals of Ukraine except temporary occupied land. So our achievements are already great. We are talking about health ministerial regulations to approve children's audio screening, and also to keep awareness of the parents or their legitimate representatives or the people who are 14 years of age about their diagnosis with the innate pathology or their risk of emergence that might bring about disability or their death. And very soon in the pipeline, So we will follow up and improve catamnestic management procedure. So which is very important whilst discharging a person from risk group. Every pediatrician, every neonatal pediatrician should provide it to the parents and to their legitimate representatives, not only the summary of the medical file, but also the address of the catamnestic monitoring clinic, and also notify the registrar of the catamnestic management about this child case, and also notify the GP in the place of residence of the child in question. And also early intervention team alike must be notified. I am convinced everyone who will listen to the catamnestic pediatric monitoring within the PMG will be able to share my viewpoint. Okay, let us do the change together, because the destiny and the life of Ukrainian children depend on us, and our joint future does also. So we would like to thank Mrs. Daria Herasymchuk, who is the presidential advisor and ombudsman for children's rehabilitation, and we carry on. So further the online event, Catamnestic Management of Children Cases in the PMG, and Natalia Gusak, who is the head of the NHSU. And good afternoon, dear colleagues and partners. Thanks very much for the arrangements and participation of this important webinar. So the PMG, I just would like to say, is very much responsive when drafting so the catering of the needs for the patients. Always it is in the nick of time to respond to it, and throughout the whole of the implementation of PMG is priority agenda to look after children, and myself as the head of the NHSU to make sure that our counterparts should have a very clear understanding of the requirements applicable for the health facilities about the availability and healthcare service delivery arrangements, and also about the size of the healthcare service to be delivered. It is my knowledge that very recent monitoring performed by the NHSU have displayed that in some areas there is not enough sufficient accountability attitude for the providers. Not in all the maternal hospitals contracted. So in the package of severe neonatal case and also healthcare service delivery in severe neonatal case, not all of them have boasted arrangements of the catamenic offices and units deployed in their clinical setting. From the social surveys, I know that not all parents understand and get to realize, if you're talking about, so 60% of parents don't get the understanding that this healthcare service is delivered free of charge in Ukraine to small neonates, newborn babies. And also my acknowledgement is actually the problem is that not all neonatologists so provide this care. As Mrs. Daria has said, the opportunity of getting access to the service. That is why I think that this webinar here is pretty much relevant for us. And I would like really to wish you all to get hold of all the required skills and knowledge, not only actually getting by to acquire it, but also make good use of it in your daily practice. And the speakers for today have prepared so loads of very interesting information. So they're very much interested to ensure the further development of this area, and would like you to be good students here and training and follow up implementation. Thank you.